And you're live. All right, welcome back. This is Senate Health and Welfare. Senate Health and Welfare. It's crossover day. Nobody can speak. I can't. And we're moving on to S53 ahead of time, which is a good thing. And we're hearing from Alex McCracken of DEVA. And Alex, welcome. Thanks for being here.
Thank you, Madam Chair. Thank you, Senators. For the record, my name is Alex McCracken. I'm the Director of Communications and Legislative Affairs for the Department of Vermont Health Access, or DEVA. And thank you for the opportunity to testify on behalf of DEVA regarding S53. While the department agrees with the intent of this bill and appreciates the positive potentials and health outcomes and cost savings that you've heard from many witnesses to date, the department is not able to recommend coverage of doula services at this time. Vermont Medicaid does not currently reimburse for doula services, and the governor's recommended budget does not include funding for reimbursement. So the budgetary impact of coverage for doula services would require either a shift of funding from other Medicaid services or an increase in the appropriation provided to DEVA by the legislature. Act 97 of 2024 directed the department to develop a reimbursement methodology and examine the potential impact of adding coverage of doula services to the Medicaid state plan. As part of that work, DEVA constructed a fiscal estimate that provides a range of impacts to the reimbursement methodology based on service utilization percentage. This estimate was established by taking the average Medicaid births from 2021 to 2023, which is 2,033 births, and applying the maximum reimbursement allowed for each rate option and its service utilization percentage. This assumes each member would utilize the full benefit for the recommended reimbursement methodology included in our budget report, which is 12 perinatal visits and 1 labor equivalent visit. All of that information is available in 54 and 55 of the current budget book and annual book. So the reimbursement methodology is proposed as well as the cost estimates. DEVA anticipates that service utilization will likely not exceed the 10 to 30% range based on utilization rates from other states. Just to give you some idea in testimony, the 10% utilization rate would be an annual gross cost of $426,000, almost $427,000. And the 30% is $1,280,000, 281,000 if you round up. DEVA would also like to note the requirement of a state plan amendment. State plan amendments are the formal process for changing, adding, or removing covered services or provider types and qualifications. DEVA has determined that a Medicaid state plan amendment would be necessary for Vermont Medicaid to have the authority to reimburse for doula services. In order to have a state plan amendment authorized, Vermont's Agency of Human Services would need to request approval from the Center for Medicare and Medicaid Services, CMS, and it can often be a lengthy process to receive federal authorization for a state plan amendment. DEVA would highly encourage caution and any attempts to obtain a state plan amendment, given the current volatility and uncertainty at the federal level. DEVA notes that coverage would likely have a limited budgetary impact, and can yield potentially significant improved health outcomes and the overall cost of care. Potentially significantly improved health outcomes and lower the cost of care. We acknowledge the potentially significant benefits of providing Medicaid reimbursement for doula services in Vermont. However, as I said at the beginning of this testimony, coverage for doula services would require either a shift of funding from other Medicaid services or an increase in the appropriation provided to DEVA by the legislature. The department also reiterates the need for a state plan amendment to be in place. In addition, DEVA has some concerns regarding the voluntary certification process proposed by OPR, and we would need to be very careful to ensure that Vermont's process meets all minimum federal requirements from CMS to allow for reimbursement. Again, though we would agree with the intent of this bill and appreciate the potential positives that other witnesses have pointed out to, the department is not able to recommend coverage for doula services at this time. Thank you, Madam Chair, and I'm happy to answer any and all questions that I can at this point.
All right, thank you. And the data that we have here is pretty clear. What might help us is if you could send us a link to the pages.
Yes.
That would be good, and then keep the input it up, and we'll have it for a quick reference.
Yes.
So questions for DEVA?
I don't have a question, but a comment or two.
Okay, let's hold that until I'm thinking that we're going to need Jen in the room as we carry on a discussion, but any questions for thank you for bringing the information. I know it was work. The waiver process, requesting the waiver is something that would have to happen. She's been asked about that. Yes, you want to ask about that?
Yes. I mean, it sounds like it's for me, it would be worth the effort of doing it. I know, Alex, that you suggested that federal volatility could be an issue, but I mean, that's an issue for everything right now. So I don't.
It is.
Yeah.
And that's the unfortunate reality of the situation we find ourselves in at the state Medicaid level.
And the volatility would just mean that they could decline it, or, I mean, what are you suggesting?
I think we don't know. And I think that there's some risk that comes with uncertainty.
Medicaid is particularly under the spotlight.
But Medicaid is under the spotlight in a lot of different ways. You're absolutely right. So, okay, we're good. That's great.
Thank you, Madam
Well,
Chair.
thank you. Thanks for coming in. And so committee, I think that we have choices here regarding the doula bill. One, and we'll still have Ledge Council in to clarify, but so one, we can pass the bill as it is and include the DIVA work and appropriation. We can ask for that. And when it goes down the hall, it'll be taken out. And then the second choice is to take that out and pass the bill to have certification for doula. And then, and as part of that, if we're taking it out, then we might consider the request for funding through our budget process in here. So put it on our list of things that we might prioritize. So those are the things we can do. And yes, Nolan,
For
thank
the
you.
record, the only fiscal, even if you take the Medicaid out and just do the certification, you still need a 20. What's that?
Go ahead.
Even if you pull the Medicaid piece out and just do the certification, you still need a $25,000 appropriation to OPRA. Just wanted to put that out there.
Right. And so, and yeah, so it will still go to appropriations. The issue for us in here is that
And finance. there's fees.
Medicaid, yeah, definitely. Both committees, a lot of work, but worth it. The work that's happening at the federal level on Medicaid and underfunding of Medicaid is huge concern. We're gonna, and then applying, work. Oh, good, okay.
May I say something?
Yes.
Yes, and as we know, we have a, medical cost crisis in the state, and this is something that would, take. Obviously, it's a less expensive option to better outcomes.
Yes.
So it saves money in the end. It's an upstream investment. It's,
It is.
everything that we've heard is
There's
here.
all those things important to prevent.
Well, it's part of the reform that we're trying to maximize and realize in this community. As you know.
Yeah. Okay, so let's do this. Jen is back with us.
Computer has to be plugged in and go.
Yeah, well. How are you doing? Can we finish up committee, Bill?
Yes,
Let's finish up. And we'll come back to do it. So
Turn it up, sit on the table.
it's good to have that. info. Remember to take that.
So.
Yes.
There's one other-
Yeah.
I can plug in.
Oh, it's plugged in up.
So if we have plugged 7 hours.
It'll reach.
It's plenty of plugs.
Yeah, mine's charged 100%.
What is it we're trying to do here?
No, it'll reach. You don't have to do that. It'll reach.
You must have done it before.
Yes, it's gonna need you to rearrange. your-
We need a different,
My laptop was about to die.
we need a different IT organizational structure.
And I can always plug it.
I have a battery backup that you could plug into. She needs power.
We all need your one.
Yeah.
Can you say, now move this forward over there. Yes, we
We got it.
Oh, you got it.
No one just lectured me on the link.
Well,
Well, it wasn't a lecture, it was just a suggestion.
I haven't
It
even.
was a suggestion.
my apologies to Tom.
You're right, look
So
at it,
that's what I'm.
seamless. You're just a little punchy. It's Friday.
That was in your reporting.
Friday the 13th.
Oh.
Friday the 14th.
You have Friday the 14th.
I don't know.
Is that Alex? Look at your phone.
I thought tomorrow was the
Is that my phone?
That's
Yes,
That's
probably.
the 15th.
Thank you.
Yeah, tomorrow.
Today's Friday.
Today's Pie Day, pizza and peach.
Oh, yeah.
Pizza and peach, that's a good combo.
Jen, have there been any changes to our committee bill title?
To your committee bill title, no.
No.
That I have not.
No, we'll just leave it the
Drafting
way
your
it is,
amendment.
we don't know what it's called.
Jen Carvey, legislative council, senior select, I was working on trying to clean, make a clean version that I could then make the new amendments on when my computer died before, so.
Wow.
Just. It's protesting. So I don't know when I left, you were discussing whether you were.
Oh, we're gonna leave the language on page 18 as it is.
Okay. Okay. Were there other changes to this?
No, the only changes were the report, having the updates on the reports. What's that?
Right, I haven't drafted, I have some things I need to draft. But I have not.
Yep.
Had an opportunity yet.
Can you tell us the things that are not in the draft in front of us? I think they're not.
Yes, two of them are just grammatical, so yeah, that I already remember. I think we are making changes on, to the couple of the representatives on the advisory committee.
Yes.
We are taking out the requirement that the representative of the FQHC be a Vermont licensed healthcare professional and, that the representative of independent practices be a Vermont licensed physician. And then on page 27, I'm adding for data integration annual updates and a requirement that insurers provide clinical and claims data to the Agency of Human Services or the healthcare data integration work. And then amending the report requirements to have annual reports and to have all of the reports address the ongoing effects of these various efforts on Vermonters and Vermont's healthcare system. I still need more information about the AHS money and positions. But I will put that in, and then we are moving the 150,000 for increased standardization of hospital budget data submissions to come from the HIT fund, notwithstanding the statutory purposes. And that is that's.
Okay, here's what I'm gonna ask us to do. No, it's our usual process. I have huge respect for what Jen's gonna bring us. So I'm going to suggest that we vote on the committee bill, pass it to the Senate with our recommendation, and then we'll look at the final draft sometime before crossover day ends, Jen.
Yep.
Okay. And we'll go through it. We'll meet up in the cloakroom or in here. I'll make sure. What is your thing?
I'm just, but have you done the optometrist bill already?
We haven't done that yet.
So if you can have other people explain to you what's in it, I can work over here and
You're on target.
try to have.
Okay,
it
you want to
for
do
you.
that before we vote? Is that? or-
I would prefer that you had got to see what these changes were before you.
Good, let's do
And
that.
I can always write the statement of purpose that describes summarizes what's in the bill after you voted, but I'd rather you were able to approve
Okay.
the language.
Good.
That's
Thank
fair.
you. Okay. We'll take the advice of our lawyer.
Yeah.
Okay.
That's good.
Okay.
So let's do that. And we're going to, we're going to change direction. And we're going to ask if you don't mind asking Senator Colmore to come down. He's a reporter of the bill, and we'll begin on that.
Yeah.
I'll go get him if you want. Excuse me.
There's a slug over here. Yeah.
Where is he? He's an ag.
He's an act.
Yeah,
Okay.
yeah. Is he an ag?
So.
Well, I'll go to